Hi, my name is Dr. Mohammed Fasahat. I'm one of the physicians here at the Sovah Hospital in Martinsville. I've been here for the last 3 years and I've been very fortunate to be able to engage with members of our community and to help them. Undoubtedly, during this time, the biggest challenge we have faced as physicians and as a community has been COVID-19. Therefore, I'm going to spend the next few minutes trying to go over the prevalence of COVID-19 at our hospital, the CDC guidelines, the latest CDC guidelines with you, and our most recent visitation policy. Now, between the two campuses, between Danville and Martinsville at this time, we roughly have a total of 35 cases, around 35 cases with COVID-19, around 15 of them at Danville, the rest at Martinsville. We do have more than adequate capacity to manage all patient needs at this time in both campuses, including our intensive care areas. Now, over the last couple of weeks, we have not seen a substantial decrease in the number of COVID cases we have on both campuses. Therefore, our visitation policy at this time needs to remain the same, which means we are operating under a very limited visitation policy. If you want more details on what that policy is, you can go visit our website at sovahhealth.com. Now, there are a few exceptions to this rule of extremely limited visitation, and you'll get details on their website. We completely understand how difficult this is for family members not to be able to visit their loved ones when they're admitted to the hospital, and we really appreciate your cooperation and your understanding of the current situation. Now, in order to help us better understand how COVID-19 impacts those with underlying health conditions, CDC has recently published some data on their website. As you can see, if people have underlying health conditions such as any sort of lung problems, including asthma, COPD, if you have a history of smoking, for example, if you have a history of high blood pressure, diabetes, any kidney problems, or any combination of these problems, you are at a much higher risk of being admitted to the hospital. Now, what are the factors that increase community spread and individual risk? These include crowded situations, close physical contact, which will include not wearing your mask in close proximity with people, enclosed spaces, and an increased duration of exposure. Now, in general, the more closely you interact with others and the longer that exposure or that interaction takes, the higher the risk of COVID-19 spread. Which leads me to my next point. And I know this is something that we have heard over a long period of time over the last several months, but it's extremely important not to be complacent and not to lose focus here. The most important things remain continuing to wear your mask, continuing to social distance yourself at least 6 feet apart when you're outside, hand hygiene, the most important of which is to wash your hands with soap and water as many times as possible. Next best is to use a hand sanitizer or any disinfectant or wipe. Let me reassure you that it is safe for you at this time to come to the hospital, to go to your primary care provider. Please do not delay care under any circumstance. Please help us prevent spread of COVID-19 in the community by following the guidelines that we have provided. Thank you.